Though not the most common disease found in pets, it can turn into a serious health concern if not treated. We're talking about diabetes, and it can happen in dogs and cats at any age. On this episode of the Paul Report, we're joined by Dr. Aron Gal, a veterinary internist at the U of I College of Veterinary Medicine. He'll talk about promising new research going on at the U of I that could dramatically change the outcome for diabetic patients. All that and more is coming up. Stay with us.
Fetcher's Pet Supply on the north side of the Charleston Square, serving the EIU community since 1991. Fetcher's welcomes all pets on a leash, is open 7 days a week, and offers made in the USA food. Pet supplies for dogs, cats, reptiles, and fish. Fetcher's Pet Supply in Charleston.
The Paul Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Power Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Thank you for joining us for this episode of the Paul Report. I am your host, Kelly Goodwin, and today we're talking all things pet diabetes, a very important topic, especially for pet owners, because there's a lot of pets out there that suffer from this problem. And joining us on the episode today is Dr. Aron Gal. He is with the University of Illinois Veterinary Teaching Hospital. We're going to, as I mentioned, talk about all things diabetes, but we're also going to talk about a very important clinical study that you're undertaking, you and your staff at the University of Illinois. So thank you for joining us for this episode. And you are new to the Paul Report. So as we do with every new guest, we like to learn a little bit about you and your background.
Thank you, Kelly, for having me here. I was born in Israel, and I went to undergrad in Tel Aviv University for my biology degree, and then I followed up with veterinary medicine at the Koret School of Veterinary Medicine. After I graduated in 2001, I worked as a private clinician for a few years. I did my internship at the Koret School of Veterinary Medicine, and in 2006, my wife and I came to the U of I to start my internal medicine residency. In 2009, I completed the residency and followed it up with another residency in anatomical pathology, and after that with a PhD. So all in all, we were in the University of Illinois from 2006 till 2015. And then we moved to New Zealand, to Massey University, where I worked as an internist until the beginning of 2019, when we returned back to the U of I.
And you have spent a lot of time studying diabetes.
Correct.
And that's what we're talking about today. Let's first start off by defining what is diabetes, and does it affect pets and humans in the same fashion?
Yes, so diabetes is essentially a metabolic and an endocrine disease where the pancreas, which is the organ that produces insulin, cannot produce enough insulin or cannot produce this at all. And insulin is essential to maintain normal glucose levels in the blood. And glucose is one of the most important fuels for the body. So if insulin is not produced in sufficient amounts, the levels of glucose are rising very high. And the reason is because the body cannot utilize that glucose. So essentially, you have a lot of this fuel flowing in your blood, but the tissues such as the brain and muscles and the fat and other important tissues, they cannot really utilize that glucose.
Is there different types of diabetes when we're talking about pets? Different variations?
Yes, so very similar, and it connects or relates to the previous question, very similar to people. Dogs and cats diabetes is pretty much the same. So there are two main types of diabetes. Type 1 diabetes, which in people would be juvenile diabetes, where there's an autoimmune attack of the pancreas by the immune system and destruction of the particular cells that produce insulin that are called beta cells. And there is type 2 diabetes, which is very common in cats, versus type 1 that is very common in dogs. And in type 2 diabetes, the pancreas is not attacked by the immune system, but there is dysfunction of the beta cells, and they do not produce enough insulin to maintain glucose control. So the common risk factors that you know from people for type 2 diabetes, such as obesity and administration of certain drugs that could antagonize the effect of insulin, they're all pretty much similar in cats with that respect. So the disease pretty much mimics in dogs and in cats what it does in people.
Is it specific to, or does it affect different breeds differently? Maybe the age of the animal differently? Is that common?
Yes. So diabetes in dogs and cats is a disease of older animals. The typical age is somewhere between 8-9 years to 11 to 13. That's usually when the onset of diabetes happens. And as far as breeds, there are certain dog breeds that we know have a very high risk. For example, Australian Terrier, Kisuns, and small terrier breeds, they have much higher risk. It doesn't mean that each one of those will develop diabetes, but when you look at the entire breeds retrospectively in different studies, you see that those breeds have a higher predilection to develop the diabetes. When it comes to cats, in this part of the world, on the northern hemisphere, there isn't really a breed predilection, but on the southern hemisphere, in New Zealand and Australia, it's Burmese cats. And unlike anywhere else in the world where males have a higher risk than females, I'm talking about cats, in Burmese cats in the southern hemisphere, the risk for males and females is pretty much equal. So there's something genetically different in that pools of cats in that area. And I mentioned that because these days cats and dogs travel across continents. So if someone, had a cat that came from that gene pool, that's something that someone needs to keep in the back of their mind.
What are some of the warning signs for a pet owner if they notice their dog doing this, maybe drinking more water, gaining weight? What are some of the warning signs to take note of?
Yeah, so as you mentioned, there are a couple of clinical signs that are very, very common. There is increase in water intake, and there is significant increase in the volume of urine that they produce, and they also eat a lot. They really, really have or develop a ravenous appetite. And that connects to what I said earlier, because they cannot utilize the glucose that they get from the food. Their brain senses that they're constantly in an energy deficient state. So it makes them want to eat a lot. So this combination of three signs is very, very typical for most dogs and cats. There are some other signs that are unique to either dogs or cats. In dogs, it's the development of cataracts, and that's something that can develop really, really rapidly within a few weeks, from being completely normal and having clear eyes to blind because of cataract, and that's just the diabetes. And in cats, a small percentage can develop peripheral neuropathies, and the classic signs is that they start to walk on their hocks. So on the hind limbs, it's as if they're walking on their heels. So these are other common signs. They're not as frequent as the increase in water intake and urination and the increased appetite, but they're definitely there.
So when you go through a diagnosis, a person comes in, gives you these sort of symptoms that their animal is experiencing. Take me now to the diagnosis and then treatment options, and then we really want to get into the meat of what you're studying currently.
So when we suspect that an animal has diabetes, we need to essentially prove that that's the case. One way to do that is to test the pet when it's been fasted for 12 hours and see if it has high glucose levels in the blood and also in the urine. Another way to do that, or combined with that, let's say this way, would be to look at certain biomarkers in the blood that are increased in diabetic pets, similar to people. And there are two common biomarkers. One is called fructosamine, which is essentially the protein in the blood that gets glycosylated because of the high levels of glucose. And the other one is a sort of hemoglobin that's called hemoglobin A1C, which is another test that most people are probably familiar with. And those allow us to see if the levels of glucose have been elevated or increased for a long period of time, of several weeks in the past. The reason why that is particularly important in dogs and particularly in cats is because there's a white coat effect, and sometimes when they travel to the clinic, they're very, very stressed and their blood glucose levels are increased, even though they don't have diabetes. So that can kind of like make a false positive diagnosis if you don't look at the other biomarkers as well.
As far as treatment, so you run the test, you check urine, check blood. What is the prognosis for a pet with, I guess, diabetes, and what would be treatment options?
Yeah, so the prognosis, generally speaking, is good. There are some complications in dogs, for example, the cataracts that are probably inevitable. And they could be treated after the diabetes is controlled by an ophthalmologist that can do cataract surgery, and essentially they can gain their eyesight again. But it's important for me to say that the prognosis is good, because there has been a study that showed that close to 20% of newly diagnosed diabetic pets are euthanized in the first year of diagnosis, both dogs and cats. And they're euthanized because of the owner's perception of what diabetes is. We all have friends or relatives that have diabetes, and in people, especially with type 1 diabetes, you live with the diabetes for many, many years. We're talking about 20, 30, 40 years. And there are some complications in people that, because of the lifespan that people have and dogs and cats do not have, you start to see like renal failure that necessitates kidney transplantation or limb amputations, horrible things that could happen with diabetes in people. But I'm emphasizing that in dogs and cats that is extremely unlikely to happen, because when they're diagnosed at the age of 10 or 11, they will not live 40 years down the road with the diabetes. So that perception in people is what leads to the euthanasia of dogs and cats in the first year of diagnosis, because they think that that will happen to their pets the same way that it happens to someone that they know. As far as treatment, the important and the essential part of treatment is the administration of insulin. There are different types of insulin, but generally speaking, you give an injection twice a day. And in most dogs and cats, unless there are other complicating factors, their diabetes is just under control, and they don't show the signs for which they have been presented in the first place, and they have a completely normal lifespan afterwards.
Let's dive into the research that you're undertaking at the University of Illinois. And I've read several things about it, and it's actually groundbreaking. It really is. So you are studying what is, I guess, considered or called fecal transplantation in the fight, if you will, to not make diabetes go away, because I don't think that we can, but make it more controllable and manageable. Tell us about the study.
Yes. So I think I need to explain to our audience what the meaning of dysbiosis is, because I'm going to use that word quite a lot. Dysbiosis means an alteration in the population of bacteria that are present in the gut. In our gut, in each one of us and also in our pets, there are billions of different bacteria, and they all live in some sort of harmony. And they're, a compound that one bacteria metabolizes is being utilized by a different bacteria, and it's kind of like a chain of reactions that we as the host are really dependent upon. Some of those mediators, particularly short-chain fatty acids, are really, really key in giving signals from the gut to the pancreas, to the liver, with regards to the control of glucose in the body. And not just glucose, also fat and other important processes. Patients with diabetes develop dysbiosis. We don't know if the dysbiosis is the chicken or the egg. We just know that it happens.
Right.
And that means that certain groups of bacteria that ferment short-chain fatty acids and other important microbial molecules that signal to the host are missing. And when that happens, there are important cells in the gut lining that signal to the pancreas to produce insulin, and those cells do not get the cues that they need to get from the bacteria in the gut. So in a diabetic patient, and we know that that's true for people, for dogs, and for cats, and some other animal models, because of this dysbiosis, we think that the signaling of the gut is to the rest of the body is altered. So the purpose of the study is trying to reorganize the microbiome to enrich it with the groups of bacteria that we know are missing, with the hope that when we restore the bacteria, the major important groups of bacteria there, those metabolites that they ferment and produce will allow for normal access to happen. There are different ways by which you could do this fecal transplantation, and the current version of this study that evolved with time is oral fecal transplantation. It might sound a little bit uncomfortable, but we're not going to let dogs and cats essentially swallow stool. We're going to take stool from donors, which I'll explain how we choose, and we're going to freeze dry it and make it into fine powder, and that powder is going to be encapsulated, and essentially the patients that are going to participate in the study are going to just take a pill, like any other pill, in a pill pocket and just swallow it. The idea is that we'll give it once a day over the 2-month period of this study, and during that time, hopefully, we'll see a transition of the microbiome from a dysbiotic microbiome to a normal microbiome. And when that happens, we hope that we'll also see an improvement in the ability of the patients to control their blood glucose.
And hence, maybe alter how much insulin that they have to take as well. Would that play into it?
Yes. So because most dogs have type 1 diabetes and most cats have type 2 diabetes, in type 2 diabetes, cats can go into remission. And remission means that they will not need insulin anymore. There's a high chance for remission in the first 6 months of diagnosis if you be aggressive with insulin therapy. The chances kind of like go down exponentially as time goes by. What we hope is that by the fecal transplantation, we will increase the number of patients that could go into the remission in the first 6 months with maybe not as aggressive insulin therapy, but also that we'll be able to get cats with more chronic diabetes into remission. When it comes to dogs, because the general belief is that most dogs have type 1 diabetes, which is an autoimmune destruction of their beta cells in the pancreas, we might not be able to completely reverse it, but we hope that will be able to significantly reduce the amount of insulin that they will need, significantly reduce the chances for complications and things like that. So we have a lot of hope that there will be hope to dogs as well, not just for cats.
We are filming this episode at the end of May, and the clinical research and the clinical study will start later this summer. You have a select group of dogs that will participate on both ends, so to speak. You will have clients, and then you will have donor dogs to use for the fecal transplantation. How do you select the candidates?
Yeah, it's a very good question. We wanted to use young dogs because we know that as you get older, there is a higher chance for alteration in gut composition, microbial composition. So we're recruiting dogs from 2 to 8 years old. We screen all dogs and cats, not just dogs. We screen all our donors with a health profile, which is a complete blood count, serum chemistry profile, and a urinalysis. We run their hemoglobin A1C and fructosamine. We send their feces to parasitology to make sure that they don't have any infectious disease in there, and also to Texas A&M. They have a GI lab there to screen for specific infectious organisms that we know can be present in the feces. So all that has already been done. So now we have a group of dogs and cats that we know are completely healthy, that these important groups of bacteria that we're trying to restore are at high levels in their feces, and now we're collecting their feces. We're going to, as I said earlier, to lyophilize them and make them into this freeze-dry powder, and we're going to encapsulate it, and we'll have a bank of capsules that we can use for the participant in the study.
How long will the study, how long will it take? How long will you be undertaking this?
We plan to do it over 2 months. And over these 2 months, we're going to have several time points where we'll take blood and feces from the recipient animals in order to see if, that will happen after the study ends, but to see that this progression, this positive clinical progression has actually taken place.
And I think if somebody out there hears fecal transplantation, I think it's important to note and to hit home that it is very safe. It is a very safe process.
Yes, as far as we know, it's considered safe. I want to emphasize that there are fecal banks for people that they can take fecal transplantation either as an oral route with lyophilized feces or as enemas, and this has been done in people with Clostridium difficile recurrent colitis. It's probably the most effective way to treat people like that. So we know that there's a lot of evidence from people that it's safe. From the limited studies that have been done on dogs and cats, we also know that it's safe.
Mm-hmm. You mentioned, a cat can essentially come out of, I guess we would call it remission from diabetes. Is that the same for dogs, or once you're diagnosed, it's a matter of maintaining it and keeping it in check as opposed to it eventually or it ever going away?
Yeah. Again, an excellent question for which the answer is not straightforward. Because we believe that most dogs have type 1 diabetes, then it would make sense that we will be able to reduce the amount of insulin that they will need, but not lead to remission. That being said, there is some evidence that some dogs, similar to cats, might have type 2 diabetes, and in those we hope that that could lead to remission. And also there is some plasticity in the pancreas where the different cell types can become from one type to the other. So we hope that maybe that could take place. So the straight answer is I don't know that dogs would go into remission, but I do hope that that would happen, and I explained why.
We've got about a minute left, and as we wrap up our interview here, what do you, when you look towards the future and you look towards this study that you're undertaking, what gets you most excited?
as you said, it's kind of like a groundbreaking type of a study. It hasn't been done neither in people or in animals before. It has a huge potential to really change the way that we manage diabetes. And as I mentioned earlier, some people are euthanizing their animals just because of the perception of what diabetes is. And we hope that if we have a simple way to overcome that barrier and potentially even get them into remission earlier, then we will not see that many dogs and cats that are euthanized for something that is treatable and curable.
And I think that's the perfect way to end this segment. I couldn't have said it better. And hopefully here in the next several months, we'll learn more. As we end out the year, we learn more about your clinical study, and I'm sure the results will be very positive.
I hope so.
Thank you so much for joining us for this episode of the Paw Report. Dr. Gal from the University of Illinois. Thank you again.
Thank you so much.
And we hope all of you will join us again for another episode of the Paw Report. Until then, I'm your host, Kelly Goodwin, and we'll see you next time.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Fetcher's Pet Supply on the north side of the Charleston Square, serving the EIU community since 1991. Fetcher's welcomes all pets on a leash, is open 7 days a week, and offers made in the USA food. Pet supplies for dogs, cats, reptiles, and fish. Fetcher's Pet Supply in Charleston.